or fine over fine, right? It has a number, like your age. How old am I? Fine. Right? No, I can't get away with fine. I have an age. I have a blood pressure. So today, am I 135 over 80, and that's fine? Or am I 152 over 85, and that's when your doctor might say, oh, you're kind of borderline today, right? Like this woman that goes 20 years borderline. So do you have high cholesterol? Has it been checked? Do you know what it is? Do you have, so when you go to your doctor, get your little, I always say, go to the dollar store, get a little book, or many offices also has this little yellow book where you have cholesterol. What's my goal? So total cholesterol, good cholesterol, HDL, bad cholesterol, LDL, and triglycerides. What's my goal and what's my numbers now? So if you don't know, I always tell the students, if you don't know where you're going, chances are you're not going to get there. So you need to know what it is. So do I have blood cholesterol? Do I know it? Do I have high blood pressure? Has it been checked? Do I have diabetes? That goes for people that we know, not just us. Do I smoke? Am I okay with that? Am I thinking that maybe it's time to start about quitting, to start thinking about quitting? Am I obese or overweight? How do I know? There's tables for that, we'll show. Do I have a family history of heart disease? What's considered significant, as I said? Greater than, some man in my family has had heart disease younger than 55. Some woman in my immediate first-degree relatives has had under 65. Am I pretty sedentary? I'm not very active. That's a risk. Do I eat a diet high in saturated fat and cholesterol? Because I don't have time to cook because I look after the children or the grandchildren, or I have soccer and all that stuff. And do I have a lot of stress in my life? The stress is important because everything kind of goes by the wayside when you're stressed. And will it last? On your to-do list, where are you? Are you at the bottom? Sometimes we're not even on the first page, eh? We don't get there unless we're sick, and then we have to stop. So know your body mass index. Do you know about the body mass index? So it's a measure of your weight relative to your height. There's mathematical formula, so you can find that on the internet. The normal BMI is 18.5 to about 25. Waist circumference, up to 35 for women, up to 40 for men. It's an important predictor of heart disease because it drives, it's called the visceral fat that accumulates there. It's not the same fat as the thighs or the arms, and it secretes hormones, and it secretes really bad hormones. Again, abdominal circumference, so you go, healthy weight, so you can figure out if you're healthy, overweight, BMI until 30, or actually obese. And if someone's obese, it's okay. That's a stage that we're at. If I have high blood pressure, that's okay. That's a stage that I'm at. So it's a condition to look after. What to do to maintain a healthy lifestyle? Well, reduce excess weight, be physically active, all the things you know. Eat a healthy diet, balance calories. We say obesity is an inability to do proper math. Does that make sense? If more goes in than what comes out in terms of energy expenditure, we gain weight. Don't smoke. If you smoke, quit. Avoid secondhand smoke. We've gone over all this. So again, take medication if prescribed, if needed. Alcohol in moderation. Get friends and family to join in with healthy living. So again, I don't want to again preach to the converted. Chores, the common stuff we do counts as physical activity. You don't need to put on the spandex and go to good life. That's very good, but it needs to be sustained activity. So, stair walking, parking the car further, pushing a stroller for 1.5 miles. Did you ever see in our area, the Tuesday morning running room has a mom and tot. So there's about 30 women with their strollers that walk or run in front of my house at about 8 o'clock in the morning. And it's phenomenal to see. Like, it's just great. It's a great social outing for them as well. washing windows, gardening, etc., etc. So now when it comes to intervention, and these will be, I don't know how I'm doing for time, but these will be my last slides. When you get to a time when you do have confirmed heart disease, there are blockages in the arteries that we need to restore blood flow. What do? We can insert a little balloon in the artery to flatten the plaque, and then we insert a little stent. A little stent is a little piece of metal that will stay there forever, ever, like any other metal and a gold tooth or any other metal we might have in our body to scaffold the artery. And if we were to look with an ultrasound like we did before, you can see the struts, the metal struts of the stent. So the stent is this mesh, this wire mesh thing. And there's no cure for heart disease, but that's okay. There's no cure yet for high blood pressure. There's no cure for diabetes. There's no cure for arthritis. There's no cure for a lot of, they're all chronic diseases, but we can certainly help symptoms and prevent events and live longer and live better. The other option that some people are faced with, the place of bypass surgery, open heart surgery like we used to call it, that is when the heart needs more blood flow and we can't do it with PCIs, with the balloons and stents. And that is basically bypassing. Here you see nice little heart. You see the aorta that comes out of it and the other big vessels. That's the front artery that you saw in an angiogram, this little thread here with the little branches. So, and this is a piece of vein that was taken from the leg that is hooked up from one of the big vessels to that artery. So there's a bypass, just like when there's construction on the Queensway and they make us do a detour, except here the blood still can still go in the artery under construction, but also goes through the bypass. Something newer is mid-cab or less invasive surgery that we can do in some situations, not if somebody needs 5 bypasses, but if they need 1 or 2, where you have just a little incision, just the way that the appendix or gallbladder surgeries have been. It's a little more complex with the heart because it beats. Like, that's the sad thing about a heart, it beats. So the surgeon is kind of trying to sew like this. So now they do surgery on a beating heart. I do angioplasties, the previous procedure. My colleagues do, my surgical colleagues do surgery. And there are now clamps now that they can use. It's called, one of the clamps is an octopus clamp. And it will be used to stabilize the artery, and the heart still beats, so surgery on a beating heart, which reduces complications. And then they can actually, with those very powerful lenses, they can attach the bypass to the artery. But Einstein said there are 2 ways to live. You can live your life as if nothing is a miracle, or you can live your life as if everything is a miracle. So it's all in the head. And moving, and generally, when people move, there's a smile. Did you ever notice? Did you ever see somebody run like this? I mean, you can't be mad and be active at the same time. It's impossible. So we had a chance to discuss the differences, the main differences between men and women in heart disease. We reviewed the current recommendations of primary prevention in women, and we talked about an action plan for us and the people around us. So health is like money. We never have a true idea of its value until we lose it. So I will leave you with that, and I'd be happy to answer any questions.